So one of the things that struck me when you were talking about functional medicine was the trend in the fitness world to talk about functional training. In other words, do we train the body the way it actually works? And the best example I could give would be the hamstring on a cadaver. If I pull on the hamstring tendon, the leg will bend at the knee. It's called flexion. In real life, that's not what the hamstring does. The hamstring keeps the leg from kicking out when I extend. It helps my glute muscle extend at my hips. And so my choice of exercises is then tied into how do I use my body in real life. Everything's different when you're lying on a table or lying on a bed as opposed to having your feet on the floor. And so I'm wondering if there isn't some sort of connection in terms of looking at function when we're looking at a functional medicine approach to nutrition.
Yeah, I think a good one, what comes to mind when you talk about that is thinking about the gut and the body. And so a quick example of maybe functional medicine is that someone might be feeling a little down or depressed or having anxiety and automatically think that maybe they might need some kind of medication. And I'm not saying that they do or they don't, but another approach, if they're working with a doctor, is something that I would help them with is to look into the gut and what's going on there. Are there things that we can do to help, whether it's eating, breathing techniques, stress relief, that can then help the gut to work better. That, as we've all heard, it's the gut-brain connection that maybe can help reduce anxiety, depression, all that kind of stuff. So that kind of reminds me of that a little bit.
And it reminds me of something we would often say when someone talks about pain. We'll often say, well, where you're feeling the pain isn't necessarily where the problem is.
Yeah,
Best example of which is, if I put a rope around your neck and pull it, you're going to say that, you're feeling a pain in your neck. Of course you are, but the directional pull is coming from that rope around your neck. And if we're not addressing that pain's not going to go away in the neck as much as you might massage it while I'm pulling on that rope.